Hello everyone, I am Dr. P. Talagas, Assistant Professor, Department of Pharmacy Practice. Today we discuss about rheumatoid arthritis. Last video we discussed about osteoarthritis. This video we will discuss rheumatoid arthritis. What is rheumatoid arthritis? It is a silent, it also silent epidemic. It is a comprehensive guide to understanding and diagnosing and managing one of humanity most debilitating the autoimmune conditions. What is meant by autoimmune condition means the person's body. First of all, understand the person's body attack own immune cells. That is called autoimmune conditions. The person's body attack own immune cells. That is called autoimmune condition. So, rheumatoid arthritis is the autoimmune disorder. It is the mostly 80 million lives in 1% of humanity, 80 million global burden, approximately 1% of people worldwide affected, and 3.3 is to 1 gender gap. Women are 3 times more likely to develop the rheumatoid arthritis than men. Women is mostly affected comparatively to the men for the rheumatoid arthritis. And US healthcare cost, direct annual cost from treatment complication 2023 for CDC analysis. Peak onset occurs between ages 25 to 55 years, striking during the prime working years and profoundly impacting quality of life. Next, what is rheumatoid arthritis? RA means rheumatoid arthritis. What is meant by rheumatoid arthritis means it is the precise definition. The core pathology, it is a chronic stages and systemic and non-supportive synovitis. Non-suppurative synovitis that progressively destroy cartilage. It is destroy the cartilage and bone through the inflammatory cascade. It is mainly affected to the cartilage and bones. What are the classification of system of rheumatoid arthritis means? Joint pattern. It is a poly, oligo or monoarticular involvement and serostates. It is a presence of rheumatoid factors and anti-CCP antibodies. Next is disease stages: early stage, moderate stage and severe stage. What is meant by early stage means synovial hypertrophy and inflammation. Synovial hypertrophy and inflammation. What is a moderate stage of rheumatoid arthritis means visible bone erosions on imaging. Severe stage, joint ankylosis and deformity of the bone and cartilage. These are the disease stages of the rheumatoid arthritis. What is mean by rheumatoid arthritis? It is a chronic disorder and a systematic and non-suppurative synovitis. It mainly affected in the synovial joint, ball and socket joint and hinge joints. These are all the synovial joints that progressively destroy cartilage and bones through the inflammatory cascade. What are the classification of rheumatoid arthritis? It is a joint pain and serostasis. Joint pain means poly, oligo or monoarticular involvement, and serostasis means presence of rheumatoid factor and anti-CCP antibodies. What are the stages of rheumatoid arthritis means? What are There are three types of stages of rheumatoid arthritis. First one is early stage, moderate stage, and severe stage. Early stage means synovial hypertrophy and inflammation. Moderate stage means visible bone erosions on imaging. Severe stage means joint ankylosis and deformity. It's the subtypes and the shape clinical decisions. First one is seropositive rheumatoid arthritis. Rheumatoid factor are anti-CCP plus in 70% of patients, higher erosive risk and more aggressive joint destruction. Destruction damage requires early aggressive therapy. Next one is zero negative. First one is zero positive rheumatoid arthritis. Next one is zero negative rheumatoid factor and anti-CCP. In 30% of the cases, often persons with milder symptoms initially but can progress to severe disease. Diagnosis relieves more heavily in the clinical presentations. The patients have the symptoms of synovial joints and cartilage and bones. First of all, do the RA factor test. RA factor test. It is a normal value of 14. It is the palindromic rheumatism. It is the episodic self-limited flames and arthritis that resolve completely between the attacks, and approximately 20% evolve in chronic and rheumatoid under Dr. Basholmes and 2024. Rheumatoid mutilans. It is the severe subtype causing opera glass and telescoping fingers and first described the data of LT requires aggressive immunosuppression drugs. These are the subtypes that shape the clinical decision: zero positive rheumatoid arthritis, zero negative rheumatoid arthritis, palindromic rheumatism, and rheumatoid mutilans. Next, why does it happen? Genetics and triggers. First one is 0.04 by 1. Variant rise risk 3 to 5 and meta-analysis in 2023. It is most affected in the adults group. Non-MHC loci means what are the enzyme present in PTP and 22 stat and trap. It is the enzyme of the non-MHC loci. And smoking. 12-fold increase the monozygotic twins and 2 to 5-fold oral and risk persisted 15 years and quitting and infectious triggers. Infectious triggers most of the disease affected in the infectious diseases in the rheumatoid arthritis. What is the pathophysiology? What is my pathology? It is the overall of the pathophysiology of rheumatoid arthritis in the one slide. We'll discuss about what is the pathophysiology of rheumatoid arthritis. T cell, first one is T cell activation. In our body, T cell will be activated. It will be activated after triggers max use cytokine enzyme, cytokine storm, TNF alpha, interleukin 6, interleukin 1b, interleukin 6. Macrophage response. It is the TNF alpha drives osteocalcitogenesis via Rankel pathway. The Panus formation. Invasive tissue release the matrix metalloproteinase and cartilage destruction. The autoantibodies. Autoantibodies means the rheumatoid factors and anti-CCP from immune complex and they amplify complement. What are the clinical significance and extra-articular fallout mean 90% of the MCP and PAP joints and 80% of the wrist and 70% of the knees affected in the rheumatoid arthritis. And also extra-articular manifestation in rheumatoid nodules 30% of patients, intestinal lung disease and pericarditis and vasculitis. These are the symptoms and the clinical significance of the extra-articular fallout. What is the domain to the diagnosis in the rheumatoid arthritis means points. It is a points grade. Grade means the scoring in the pain. Joints at 5 percentage, 2 small joints and 3 percentage, 1 to 3 small joints, 2 RICCP higher tier 3 elevated CRP and ESR. CRP means C-reactive protein, ESR means erythrocyte sedimentation rate and symptom duration in the 1 week. These are the analysis of the rheumatoid arthritis scoring scale. Next one is treatment roadmap from treat to target to precision medicines. Early DMARD therapy. What are the drugs used in the treatment of rheumatoid arthritis? Methotrexate. Methotrexate 20 mg per weekly and folic acid initiated within 3 months of diagnosis to prevent the irreversible damage. Reversible damage means it is the degeneration. Reversible means it is the use for the degeneration. Irreversible cell injury means it is the necrosis. So first line drug of the rheumatoid arthritis means early DMARD therapy, methotrexate with folic acid is iron tablet. Second one is biological TNF inhibitors. What are the drugs used in the class of etanercept and adalimumab? It is a 60% achieve the rheumatoid arthritis. The JAK inhibitors, upadacitinib and filotinib. These are the oral option with the 40% of remission rate in the biological native patients. And biosimilars, 2025 FDA approved the 12 biosimilar DMARDs cut costly 30% improving the accessibility. Target to target strategy. Aim to remission low disease reactive within the adjust therapy every 3 months. These are the treatment of rheumatoid arthritis. For the lifestyle modification, disease activity measurements. Dash 28. It is a disease activity score using 28 joints. It is a scoring scale and CDI clinical disease and activity index and SDI simplified disease activity index. The scores guide escalation in or tapering of the therapy means evidence-based lifestyle levels means this is the smoking cessation and Mediterranean diet and excessive program. Reducing the progress in the risk 2020 long-term study. The lower CRP levels in the JAMA 2023. Improvement in the HA score in the excessive program. Okay, these are the overview of the rheumatoid arthritis. Last class we discussed about osteoarthritis. Today we discussed about rheumatoid arthritis. Both are the different. In the rheumatoid arthritis, what is special means in the treatment of rheumatoid arthritis, all of you know about anti-malarial drug. Anti-malarial drug. Malaria is caused by the bacterial infection. Which is what type of bacteria affected the malarial disease means Mycobacterium tuberculosis. Sorry, Mycobacterium falciparum, Mycobacterium ovale. These are all the cause of the malarial disease. Plasmodium vivax, Plasmodium ovale. These are all the cause of malarial disease. First line drug of antimalarial drug is hydroxychloroquine. Hydroxychloroquine. That hydroxychloroquine is the first line drug of rheumatoid arthritis, 100 mg. Okay, so what I tell, the drug used for the multiple purpose. We study the hydroxychloroquine, the anti-malarial drug classification, but in practically use the rheumatoid arthritis treatment. Okay, so but first of all, overview of rheumatoid arthritis. Rheumatoid arthritis is the chronic disorder and degenerative disorder mainly affected the synovial joints that only continue affect to the bones and the cartilage. Then will be inflammatory cascades. Okay, these are the overview of rheumatoid arthritis. Okay, thank you.